The number of daily COVID-19 infections in South Korea has been on a wave of ups and downs lately, and the latest figure confirmed as of 9 p.m. last night was over 1,200.
Now, that is a touch lower than the previous night's figure, but still 200 higher than what we were seeing at the start of the week. For more on the numbers and other updates, joining us in the studio is our COVID-19 correspondent, Kim Yeon-seung. Good morning.
Good morning.
Now, is there any reason to believe this uptick? It isn't huge or anything like that, but is there any reason to think that it might potentially derail the government's living with COVID-19 scheme that's supposed to start on November 1st?
Well, it doesn't seem like it for now. South Korean health authorities are expecting around 1,300 infections for Thursday's official tally, and this figure does blend well into the overall downward trend that the country has been seeing lately. Authorities said Wednesday that they're currently drafting a comprehensive plan so the nation can gradually phase into living with COVID-19 from November 1st. Authorities are expected to announce specifics sometime this month. But if there's one thing we've learned 2 years into the pandemic, it's that with this coronavirus, you have to expect the unexpected. We can't rely on high vaccination rates to stave off infections, and there's no guarantee the downward slope of COVID-19 infections will always remain a downward slope. So if you look at Singapore, for example, they've already surpassed 80% in terms of vaccinations, and they are very hopeful of seeing an end to COVID-19 restrictions by October 24th. But unfortunately, their daily COVID-19 tally hasn't gone down despite the high vaccination rates. In fact, they've been seeing around 3,000 infections every day, with the tally reaching almost 4,000 earlier this week. So Singapore has decided to extend its social distancing measures, including the cap on gatherings, until late November. So I suppose the best approach for people in South Korea to take right now is to remain hopeful, but not complacent.
Right, then Yeon-seung, how is South Korea currently doing in terms of its vaccination?
Well, South Korea is actually doing very well. South Korea's top health officials says that the country will soon reach 70% of the population as fully vaccinated. The commissioner of the Korea Disease Control and Prevention Agency, Chung Eun-kyung, said Wednesday the 70% figure will likely be reached this weekend or by Monday next week. And this milestone is very important, as it was a precondition for the resumption of the pre-pandemic lifestyle. South Korea's vaccination rate currently stands at 66.7%, and with the momentum we are seeing, there's a good chance the vaccination rate might even reach 80% by next month.
Yeah, that's pretty astonishing considering what most people would admit was rather a slow start in terms of vaccinations, that we could even hit 80% by next month. But that's South Korea. How about other countries in terms of their vaccine rollout?
Well, U.S. is looking to greatly expand their vaccination reaches. The Biden administration is currently prepping to vaccinate millions of children aged 5 to 11. U.S. officials on Wednesday outlined a plan for vaccinating children and said they've already acquired enough vaccines for roughly 28 million kids. Anthony Fauci, the nation's top infectious disease specialist, says this is a step that is critical in curbing the spread. But as children has different needs compared to adults, health officials thought it'd be best if they were vaccinated in an environment they were more familiar with, like pediatric offices and schools. The U.S. Centers for Disease Control and Prevention is expected to announce its decision sometime in November. The FDA also just authorized booster shots for people who've had the Moderna or Johnson & Johnson shot. They're also allowing the mix and match approach, where people can get a different type of jab from the one they originally had. This expands the U.S. booster campaign to include tens of millions more people and gives more flexibility to health services.
Okay, now Yeon-seung, thank you for your report again today. We will talk to you again in our midday newscast.
Looking forward to it.